Thank you for watching On Call for All Kids. Today we're talking about strep throat. We'll discuss when to worry about your child's sore throat, what causes strep throat, and how to identify whether it's a virus or strep. I am joined by Dr. Rachel Dawkins. She's the medical director of the Pediatric and Adolescent Medicine Clinics at Johns Hopkins All Children's Hospital. Great seeing you, Dr. Dawkins.
Thanks for having me, Ashley. Good to be here.
So, what do we need to do as parents if our child complains of a sore throat?
So, sore throats are very common in kids, and parents are always worried when their child complains about a sore throat that it's strep throat. But actually, most commonly, sore throats are caused by viruses, and sometimes they're caused by allergies. So, strep throat is not the most common cause of sore throat, but parents are always worried.
Well, what exactly is strep throat?
Great question. So, strep throat is an infection of the throat or tonsils by a bacteria called Group A streptococcus. So, Group A strep is commonly transmitted by respiratory droplets, so coughing or sneezing. It can also live on some surfaces. So, kids that often touch something and then touch their nose or mouth or drink from a cup from somebody that had strep throat might actually get strep throat.
What are the classic symptoms of strep throat?
So, strep throat is usually very mild. Kids might have a very sore throat, but they won't have nasal congestion or coughing. If you look in the back of your child's throat, you may see enlarged tonsils. You may see some white patches on those tonsils, or you may see some red dots on the roof of the mouth. And that's most commonly the things we see with strep throat. In kids, they can also have headache or stomach ache, and that can be common. Strep can also cause skin infections such as impetigo, and that's something we commonly see with the infection.
Now, what would be some symptoms that would maybe mean that it's a virus versus a child having strep throat?
So, most commonly, kids may have a sore throat, but they'll also have nasal congestion or cough or even pink eye. And those are more viral symptoms. So, if your child has any of those other things, it's unlikely that it's strep throat and is likely due to a virus.
What are the treatments for a sore throat and more specifically for strep?
Great question. So, strep throat needs to be tested by your child's pediatrician or doctor. So, they need to do a rapid test for strep and or send a throat culture to confirm that this is strep. If your child tests positive for strep, they should be treated with antibiotics. If they test negative for strep, then we just need to do supportive things for the sore throat. So, acetaminophen or ibuprofen for pain or fever, or even easy things like cold things like popsicles or honey if your child's over one, gargling with salt water. Those can all be things that can make your child feel a little bit better with their sore throat.
Alrighty, Dr. Dawkins, thank you so much for joining us today. It's always a pleasure seeing you.
Great seeing you too. Thank you so much.
And thank you all so much for watching. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. There you'll find a lot of great topics in pediatric healthcare and other wonderful resources for your family. We'll see you next week.